are some long-term side effects of VSG surgery?
Well, I mean, all the good ones are losing a bunch of weight, increased
Yeah.
health, increased quality of life, that sort of thing. The one sort of like negative thing that can happen is reflux after gastric sleeve surgery.
Mm-hmm.
The sleeve is a good reflux operation, which means if you come in with some reflux, you can have a good chance that your reflux is going to be better down the road after the sleeve. A lot of that is a pressure issue, too much pressure in the tummy, almost like when ladies are pregnant, it kind of pushes up. People get reflux, you get stress incontinence, sort of things like that. So as that pressure gets better, as the weight comes down, the reflux can get better. And sometimes there's a thing called a hiatal hernia, which is if the space, I'm going to use the pen again because it entertains people.
We love visuals here.
There's a space in the diaphragm that the esophagus kind of goes through. And if that space is a little too big, that's what we call a hiatal hernia. So oftentimes during the procedure, we'll tighten that space up, and that'll form like a higher pressure zone at the top of the sleeve to help prevent reflux, and that treats it as well. But there are a percentage of people who either had some reflux or they had no reflux, and it gets a lot worse down the road. I mean, it's a relatively small amount of people, but that's like the one longer term issue that you'd worry about with a sleeve.